Don't underestimate this capsule. Inside it is a tiny camera. Swallow it, and it can see clearly what's wrong with the intestines. At first, the girl only had a sore neck and a rash on her body. Haos guessed she had meningitis and other diseases. A 1-meter-long needle was inserted into the girl's body. This is called a spinal tap, and it's unbearably painful. But the test results were all normal, ruling out meningitis. At this moment, the girl's mouth and eyes suddenly started bleeding. Doctors used an endoscope to find the bleeding point, but found nothing. So they used this miniature camera, which can go directly into the intestines, hoping to find the bleeding point. In the transmitted photos, a slight suspicious spot was found. Combined with the symptom of a sore neck, Haos guessed it might be caused by bone cancer. To get a bone marrow sample, a bone marrow aspiration was needed. A needle twice as thick as the last one was inserted into the girl's back. The severe pain made the girl cry. The good news is that the test was normal, not bone cancer. The bad news is that for some unknown reason, the girl started having recurrent neurogenic seizures and recovered on her own every once in a while. Doctors held an emergency consultation to discuss the cause. Some doctors said it was drugs, but the girl was an athlete, and pre-competition drug tests had ruled out drugs. The most likely cause was intracranial hemorrhage. Haos arranged for a brain CT. Sure enough, there was severe intracranial hemorrhage. The blood clot was pressing on the brain, which was dangerous. Surgery was needed immediately to remove the blood clot, but the cause of the bleeding was unknown. Haos sorted out all the symptoms, but they were all denied, and the condition reached a deadlock, until Haos saw the balloons in the ward. An assistant said they were sent by the girl's teammates. Haos asked why no boys had come to visit. He heard that there really weren't any. He wondered, the little girl was a diving champion, sweet and lovely, and should be popular with boys. How could there be no one to visit her? Could it be that the boys were avoiding her? Haos asked his subordinates to do a red blood cell test. The results showed that the red blood cells were scattered like a group of ants. It was thrombotic thrombocytopenic purpura, or TTP for short. TTP induced the girl's previous illnesses. There are two causes of TTP, either tumor or pregnancy. Cancer had been ruled out. The only explanation was pregnancy, but the girl was only 12 years old. Examinations found that she was indeed pregnant. The girl begged Haos not to tell her parents. He respected her choice and kept it a secret. After the abortion, the girl recovered. Haos saw through the window that the mother and daughter were hugging and crying. It seemed that the girl had finally told her mother the truth.